Hello, everybody, and welcome back to today's episode of Twomey Time. We have a very special guest on today. We have Dr. Anya Vierra. She has her doctorate in physical therapy. She is also a certified strength and conditioning specialist. She is the owner of Pacific Pelvic Health, and she is located on Maui, and that's where her business is locally owned and operated. So, welcome, Anya. Thanks so much for coming on to Twomey Time. Thanks so much for being here.
Thanks for having me. I'm so excited.
Yay! I am so thrilled to talk with you because we are bringing together some of my favorite topics. One is pelvic floor physical health and being a female, of course, and then of bringing into the context of the conversation about being a female athlete. I think that's so important to highlight, and that's why I'm really excited that you're both certified in strength training and as well as a physical therapist. So, thanks so much for being able to come on and excited to get into everything pelvic floor physical health, which will be
Yay, I'm
great.
excited. I'm excited to talk about it all too.
So I'm just kind of curious, just for anybody who doesn't really understand the background that it takes to become a pelvic floor physical therapist or just a physical therapist in general. Can you tell us a little bit about the type of education or the background that you need to have to become a physical therapist? Do you mind talking a little bit about that?
Yeah. So just as anyone who's gone to a graduate degree, we have to go to undergrad first. We have to get our at least 3 to 5 years in, depending on how long it takes you with whatever major you have. A lot of people who go into physical therapy grad schools, they typically start in kinesiology. I myself started in human biology, but I had people in my cohort who were psychology majors. I had people who were anthropology majors. So everyone's a little bit different, but kinesiology is what most people think about. As long as you get all of the classes you need to apply, that's what really matters. So you could be a marine biologist and still apply for a physical therapy program as long as you have your classes you need, like physics, anatomy, physiology, all of those things. So it's that 4-year undergrad, and then we move into our doctorate program. So it used to be a certification a long, long time ago. Then it became a master's, and I believe about 15, 20 years ago, it started to transition into a doctorate program. And now everyone who goes through a physical therapy program here in the United States goes through a doctorate level education, and they get their doctorate in physical therapy.
Oh, so much schooling, but all like good schooling because you get to also spend your first undergrad studying whatever you choose to study. And I think that's what's super unique about this field, too, is that you can do anthropology, kinesiology, like you said, or marine biology. You're right. You can really, as long as you get those core curriculum credits in to apply, you can continuously, still become a physical therapist at the end of the day. And
Mm-hmm.
this strength in the certified strength and conditioning specialist, can you tell us a little bit about if this was like something you've always were focusing on? Were you always an athlete growing up and that's why you were interested? Or did you get interested kind of in the program once you were going through your DPT program and then decided, hey, I do really want to continue on to get the certification?
Yeah, so I actually heard about CSCS when I was in my undergraduate degree at UC Santa Cruz. I was getting my hours in for physical therapy school at a local clinic, and I was working as an aide and also a front desk person. And my first year, I didn't get into physical therapy school. And so I was starting to think about other options just in case I didn't get in again. And I had a friend he graduated from his undergrad degree. I played water polo my whole life. I've swum
Oh,
and played water polo. And we actually met because one of my teammates was dating him. He was like a big professional volleyball player. And he got a CSCS, and he started actually training NFL athletes. And so I just had seen him kind of go that route with everything. I knew originally was planning on being a physical therapist. And then I just watched him really dive into the strength and conditioning world. And so I started actually asking him some questions about what a CSCS was. And I really liked that you had to have your undergrad degree. It had to be in some sort of biology, kinesiology. It had to be something that had to do with the human body. And then you got your CSCS by taking an exam, doing a lot of studies with that. And then you had to get hours in either strength and conditioning of some sort or sense.
yeah.
But yeah, so I've always been an athlete my whole life. And I think just having my collegiate physical or water polo career kind of linked me with some people within that world too.
Totally. So you played in college, so at the collegiate level. Did you go all your every year you were competing in water polo?
It's a long story, but my freshman year we got NCAA. We were out of that after that, and so we actually became a really competitive. Um, oh my gosh, why can't I think of the name of it? It wasn't an NCAA team. It was. It starts with a C, but
Like a
yeah,
club, like a
well,
competitive
yeah,
club teams. Yeah,
yes,
that are
we
massive.
were.
They like still compete nationally. Yeah, yeah.
Yeah, so we competed actually in nationals, and we got third in the nation for our club
Whoa.
team my freshman year. And then my sophomore year, I ended up actually breaking my thumb playing water polo, and I had to sit it out. And I did play it a little bit at the end of the season when my thumb healed. And then my junior year, I just really wanted to focus in on physical therapy and trying to
Totally.
get all my hours and get my grades up a little bit, because playing in a collegiate sport, your grades don't matter as much. So I needed to get those up in order to get in. So I actually left my junior year.
That makes sense. I mean, I feel like it's really hard to be an athlete when you're in one of these degree fields. It's just very time consuming. It's very heavy when it comes to lab time. So it's really hard to be a competitive athlete. But that's really neat. I didn't grow up in an area, I grew up kind of on the East Coast. So we didn't really have a lot of water polo. So I always feel like water polo is such a unique sport. It seems like a lot of stamina, a lot of conditioning, and it's not everywhere. So I think it's really cool that you were able to do that.
Yeah, yeah, it's a very West Coast thing. I grew up in California, and I grew up in a place that's 115 degrees in the summer. So it was a way of my parents keeping me cool, keeping me in the water. And I'm just a very hyperactive person. And so it was a great way of burning off some energy. And I liked the kind of fighting part of it all. It was, yeah,
Totally.
it's very
And it's
aggressive.
you get the cardiovascular training, and then it's also a lot of it is still a ton of strength training. You need so much core control and power to be in the
Hmm.
water there too. So how did you transition from being like a collegiate athlete to focusing on I don't know, I'm assuming you focus more on just like your strength training outside of the gym, outside of your practices. So that must have been like a whole transition for you.
Yeah, so CrossFit actually started in Santa Cruz, California, where I went to UC Santa Cruz, and we had a lot of our dry land activities in water polo was with CrossFit, and so we did a lot of CrossFit weight training. And so I had had that experience with our club team, and then I got more into weightlifting when I left because I had to now create my own workouts. I was so used to having like a coach creating my workouts.
Totally.
And so I got a little bit more into weightlifting through that, and then also working at the physical therapy clinics and getting that experience there too. And then I started to try and run and all of that, which I hate running. But yeah, so I got into the strength world there. And then even in physical therapy school, right, we have therapeutic exercise, and it's really learning how to utilize exercise to create a change in either strength or neuromuscular control that we are looking for. And so you actually want to practice a lot of those things when you go to the gym so that you can better educate patients in the future. And so I ended up practicing a lot of that and getting even more into strength training through physical therapy school.
Very neat. I think that's like a very typical transitional athlete that's coming out of a collegiate level sport or just really an athlete in college or even in high school, and then you're like, what do I do? How do I continue to strength train? How do I continue to be an athlete but just in a total different perspective? Like there's no longer a team, there's nobody pushing me to go. So it is a really unique transition. So I love that you kind of found an avenue where you can help people with that constantly, because it's a tough transition for a lot of people. And even if they've been doing it their whole life, they don't necessarily like understand how to do it on their own and what to focus on their own. So I think it's really cool. I'm kind of jealous because I always thought I wanted to be a physical therapist actually. And then obviously I did not end up going the PT route, but I sometimes still think about it. So it's cool to hear.
Yeah, yeah, no, it's so funny you say that too, because I'm sure you have had the patient that's like in their 60s, and they're like, I played football in high school, and they talk about how active they were then. And like, I
Yes.
used to do all these things, and you're like, you still can, like, but
Yeah.
there's just a different way of going about it. And they were so used to someone else doing it, and they were so strong in their youth and so able, and they had someone telling them, and now it's like, oh, how do I do that with this transitional period in my life? Yeah, it's very interesting.
100%. And I think you're in a really unique opportunity where you're at right now as a physical therapist because you get patients or you see patients in a very different manner. They're either coming to you with an injury of sorts where they want to get back on track, get back to whatever their functional habits were before their injury, or they're coming to you in a preventative manner, which you probably don't see a lot of, but maybe you do in the strength and conditioning side of your coaching. Or your specialty. And then you also get the people that like are kind of in this in-between phase where they have an injury, they get a little bit better, and then they're maybe not doing maintenance, and then they end up coming back to you. So I feel like you get this opportunity to kind of help put the bug in their ear about this, early on. But that probably can frustrate you if you're seeing them on the side of things where they have an injury and then they're coming in to see you versus on a preventative aspect.
Yeah, definitely. And that's part of the insurance-based model too, right? Like insurance isn't going to necessarily always support prevention how we hope it would. And so I wish we were able to see someone more in a preventative way. But sometimes the healthcare system and way it's oriented doesn't allow for that.
I know.
Yeah.
Let's we're gonna get into everything pelvic floor physical health, everything for the female athlete today, which I'm really excited about. So I figured a fun way to kind of get us started would be to just do a quick debunking round of common myths about pelvic floor physical health and pelvic floor PT. I feel like a lot of people don't really understand what it means or have this misconception about what it is. So we'll just do like a quick round and then we'll kind of get into some of our topics today. How does that sound?
Sounds great. I'm excited.
Awesome. So, number one on my list that I hear a lot is my pelvic floor health is only important to work on after pregnancy.
That's a great one. I mean, it is funny because when I talk to more people, they're like, "Oh yeah, so you treat someone after pregnancy, Kegels, right?" And I'm, I see so many women before they even are deciding to try and get pregnant who actually have a lot of pelvic floor issues. I see a lot of women who have never been pregnant and are now going through menopause who have pelvic floor issues. And I think that makes them more afraid about reaching out because they think that this is for someone who just had pregnancy, when really it's for anyone with a pelvic floor. Anyone and everyone who has a pelvis has a pelvic floor. And so it can be with any stage of your life. And that means whether you've had a baby, whether you've not had a baby, whether you had a baby 50 years ago, it doesn't really matter whether you had a baby or not. We can still help you with whatever pelvic floor issues you're experiencing.
Totally. And that kind of goes into like my next debunking myth here is that pelvic floor physical therapy is only for females.
That's a good one. Yeah. It's everyone has a pelvis, right? Everyone has a pelvic floor. And whether you were born with a penis or a vagina, you have a pelvic floor, and pelvic floor physical therapy can be for you. And there's actually a big subset of pelvic floor therapists that work with pediatrics. So bedwetting,
Totally.
bowel movement loss, oncoparesis. Those are all little things that pediatric pelvic floor physical therapists help with and can actually help with potty training. And it's really huge for those potty training parents who are really struggling with their 8-year-old who's still bedwetting.
Good to know for all our parents out there. I'm sure that's definitely something. I feel like that should be in every parenting class is how to help
Yeah.
potty train your child.
Yeah,
That can always be
seriously.
helpful. Start young,
Mm-hmm.
create good habits then, so that it stays with them their whole life too. So, that's
Yeah.
wasn't even thinking about the pediatric side of things, but that makes a lot of sense.
Yeah. And then for males too, and anyone who's gone through gender affirmation surgery, right? Pelvic floor physical therapy can be for someone who has erectile dysfunction, for a man who has urinary urgency frequency, pelvic pain, pain with sex, all of those things that can be for a man, woman, anyone with genitalia in between, all of that.
Totally. And that's really important to highlight because I feel like society just doesn't know that. And even providers, they don't even think about, I don't think they feel, I know they're not thinking of your male coming in with all these complaints. It's not something that they're first line recommending for pelvic floor physical health at all. I know that firsthand. Or it's let's get you to a urologist, and then it's really we're waiting 2-3 months for a referral when we could have been working on things at the beginning or prevention focused.
Mm-hmm.
So urinary, I want to ask about this. Urinary incontinence is a normal part of aging.
That's a great misconception. And it's something I used to see a lot at the hospital when I worked there. While urinary incontinence is very common with aging, it is not necessary, especially when we are hitting it earlier on when someone sees the initial signs of urinary incontinence. If we can see someone once their urinary incontinence starts, when it just dribbles, we can prevent that extreme incontinence that can happen. And when we're thinking about our older adults, they have a lot of the time what's called functional incontinence, meaning they're unable to get to the bathroom in time due to mobility restrictions. And so when we can really talk about all aspects of incontinence, that's beyond just like pelvic floor strength or health or what have you. And we can talk about their ability to walk to the bathroom and pull down their pants functionally too.
Yeah.
That's huge. And that doesn't have to be a part of aging when we can really start hitting on strength, ability, physical capabilities, independence beyond just like the thinking of pelvic floor weakening or what have you.
100%. I mean, I see that a lot in my older patients. It takes them, even to get from across the room, takes a lot of time. I can't even imagine if I really had to go to the bathroom, I would be incontinent too, or having some form of leakage, because it takes me so long to get to the bathroom. And depending on your living situation too, it's so relative and important to talk about. So good point that you brought up there. We should be asking those questions too, because sometimes it's just not gathering enough information. Before we're really kind of jumping to conclusions sometimes as well. So that's a really good point that you brought up there. Um,
Mm-hmm, mm-hmm.
so one of my common myth question or question I get a lot from my patients that I tend to refer over is, do I have to get naked to do pelvic floor physical therapy? That is the number one concern.
Yeah, that's so funny because I actually just met up with an acupuncturist today and we were talking about like what does my normal evaluation look like? And she was like, yeah, so you just check pelvic floor day one. And you have to use your finger internally and all these things. And I was like, there's so much more I can do as a pelvic floor physical therapist. I really think about pelvic floor therapy as an orthopedic specialist as well,
Mm,
because we're looking at the whole body and how it interacts with one another. But we're also very holistic in the fact that I'm looking how your behaviors change things. I'm looking at how your movement patterns change things. I'm looking at how your fiber intake is affecting your bowel movement patterns, which can then affect your pelvic floor. So if someone is uncomfortable with checking pelvic floor in that more intimate way, where we do have to remove clothes and we are going to be looking at the genital region and touching that region and assessing that region.
mhm.
We don't have to do that day one. We don't have to do that day two. We don't have to do that at all if someone is really not feeling comfortable with that. And it may not even be a pelvic floor muscular issue. It may be a behavioral issue that we need to start changing and moving that route to versus a strength or awareness or coordination of the pelvic floor muscles.
100%. And I feel like once patients understand that, they are way more open to it as well, especially when it's all about benefiting the patient, right? We're not doing something because unless it has a benefit towards them. So I think that with some further just explanation, even on our end before we're referring and easing their mind to start out, I bet it can really help you on your end of things too when you have that initial evaluation as well. So, um,
Yeah.
love that you said that, because you're right. It's all relative to the patient and all relative to what they're feeling confident and comfortable with in their own body. So, and
Yeah.
respecting that too, of course.
Yeah. And your
That's great.
pelvic floor physical therapist should always meet you where you're at. Yes, at times it's very important and very helpful to get that information, but it's not always necessary, especially if it's not something you're comfortable with.
Mhm. Okay, my last question is, pelvic floor physical therapy is just all about teaching me how to do Kegels, isn't it?
Yeah, I actually I found this really funny video off of Comedy Central, and I think it was like Paul Rudd, and he was joking around about being a Kegel coach, and how like you should contract your cervix and all these things, and I just like laughed out loud about it. But while Kegling is helpful for a very small subset of people, it is typically not the one thing I'm giving to people. I'm a lot of the time actually giving the behavioral changes we talked about, nutritional changes that are within
Mhm.
my scope. Um, Referring out if I feel like it's necessary, if it is a big medical complication, looking at hips. Sometimes I'm just giving hip strengthening and standing on one leg and stability strengthening to somebody because that's what's actually needed so their pelvic floor doesn't have to do all the work. Um, And sometimes, and a lot of the time, it's down regulation. So learning how to relax those muscles, learning how to release those muscles so that you can pee, you can poop, you can have sex comfortably without pain or discomfort. And then if we feel like it's necessary and we need to do some strengthening, that usually comes later down the line.
I see. So I'd love to just get some like definitions out there or have a better understanding of something like pelvic floor. So since we talked about Kegels, do you mind explaining like briefly or how you would say to one of your new clients, like what a Kegel is, what it can be helpful for, and how to perform it properly or work on
Yeah, that's a great
performing it
question.
properly?
I actually have Penelope the pelvis right here.
Yes.
So
I
for
love
those who
Penelope.
can for those Penny for shortness. But for those who don't know and or have a video, they can see. But I'm going to explain it if you don't have a video too. So our pelvic floor, it is a hammock from our pubic bone between our two sit bones all the way to our tailbone and around our sacrum right through here. So there's all a red object that you see if you have a video. So it's really what we're sitting on. So if someone's sitting right now listening to this podcast, their muscles are right at the base. It should be close to the object that you're sitting on, in between those two sit bones that you can feel underneath your bottom. And so when we think of activating our pelvic floor muscles, we need to both activate these superficial muscles. So you have muscles just right at the surface underneath your genitalia, and the skin underneath that. And then we have really deep muscles that are actually the bowl of our pelvis. And all of these portions of the muscles do something different. But when we're really thinking of a pelvic floor contraction, we're thinking of a squeezing of the muscles down here. So squeezing off and closing of the urethra, of the rectum, and then if you have a vagina, of the vagina, and then a lifting up. So we call it a squeeze and a lift of those muscles. And for women, it can be imagining picking up a blueberry with your labia and lifting it up inside of you. It can be thinking of stopping gas and zipping up to stop urine from coming out. For men, we sometimes think about a turtle head pulling into its shell. And we can also, same thing, think about stopping gas from coming out, stopping urine from coming out. So there's a lot of different kinds of cues we can get, but really a squeezing and a lifting of those muscles.
Gotcha. And thanks for going through that for men too. I think that that's important to touch base on as well. So I
Mm-hmm.
guess from what is work? Is it important to work on Kegels, number one? And if it is it something that should be practiced often? I feel like I get that question a lot, or people bring that up preventatively to me as like a preventative measure. So I guess let's focus on like what is a Kegel good for to practice, and why is it good, and if it is good, and let's start there.
Yeah, so I'm actually looking at not just like your ability to squeeze and relax those muscles or squeeze and activate those muscles. I'm looking at how long can you hold a contraction for. So I'm really trying to test your endurance strength of those muscles. I'm trying to
Mm,
check, can you turn them on repeatedly and turn them off repeatedly? So are you able to coordinate a squeeze for 2 seconds and relaxing and repeat that for at least 10 times? And then I'm checking, can you turn them on quickly and turn them off quickly? So quick on and off. So what we call power strength of those muscles.
I
And
see.
all of these things are something important to assess and something important to have. We need to have endurance capacity of the muscles, power capacity of the muscles, and then just awareness in general of being able to activate them when we need them to. So all of these things are for helping with like coughing and sneezing. So that is it helpful to work on power and coordination of turning them on during like coughing, sneezing, laughing. But then we do need to have some endurance capacity for running, any sort of endurance strength sport that requires us to stand on one leg for any portion of time, because that also is important for the stability of our pelvis. So yes, Kegels can be very important, but we want to think about what kind of Kegels that we want to have
Yeah.
someone do, and it's dependent on what issues they're experiencing.
I see. So, from a preventative health standpoint, let's talk about a young female athlete. Let's start there. So, maybe a young female or male, but I know we're talking a lot about females today. So, a young female who's doesn't really particularly have any problems per se. They're not planning for pregnancy. They're just an athlete. Maybe sometimes they have a little bit of incontinence or stress urinary incontinence if they're jumping rope, or maybe every great while they're running, or it's becoming more of a pattern. So what are some things for young adults that they can focus on for prevention wise to have a healthy pelvic health? I would like to focus on that too.
Yeah, I think for anyone who's having any sort of incontinence, even if it's just like every once in a while with like jump rope or very rarely with running, I do think no matter what, they should be seeing a pelvic floor therapist, whether that's physical or occupational therapist. We both treat pelvic floor depending on who you are. And to just get those muscles assessed and see what else is happening that may be contributing to it. But a lot of the time, for someone who has never had incontinence, never had pelvic pain, any of those things, we really want to work on breath work. So understanding intra-abdominal pressure management. So not holding your breath through activities, being able to utilize your exhale if you're able to, understanding how to properly Valsalva or like do what's called a not a bear down. We don't want to bear down, but a bracing. We want to be able to properly brace those muscles for a athlete that is heavy lifting or is a power athlete that has to brace every now and then and hold their breath, but how to do that properly. So learning how to engage the pelvic floor and deep core correctly. I do find just having good, healthy bowel and bladder habits is a huge prevention in itself. So learning how to
Yes.
properly sit on a toilet and pee is huge. Learning how to utilize a squatty potty and why something like a squatty potty is helpful for bowel movements so that we're not constantly bearing down through the tissue. Those are those daily things that we're doing, peeing, pooping. Those are super important to work on behavioral wise for prevention of pelvic floor issues later down the line.
Oh, so you're saying that everyone, regardless of problems, should
Mm-hmm.
be having, it sounds like definitely better body mechanics is huge when, especially when it comes to using the restroom, seeing as that's something we all do and we all do it multiple times a day. So
Mm-hmm.
is it true that we should all be investing in this squatty potty situation? I personally don't have one, but maybe I should go get one.
Well, it's funny because I think squatty body is like actually a copyright, you know? So as long as, and we think about it, where the squatty potty positioning, that's what I really want
Right,
to think
right, right,
about
right.
is we want to have our feet flat and we want to have our knees above our hips.
Mm.
So having that more squat-like position, we can have that by putting two toilet paper rolls underneath our feet just to get our feet up. Because that position in itself is actually going to tilt our pelvis under just ever so slightly, and we have a muscle that kinks on our rectum, and when we get into that position it helps with just unkinking it, allowing our bowel movement to flow out and open up without having to push excessively, which can cause prolapse and other prolapse like symptoms later down the line.
Totally. And I wanted to talk, I do think it's super important to talk about breathing because I think that is really relevant to the preventative aspect of pelvic floor function and health. Can you, so say maybe someone's like new to exercising or new to weight training, can you kind of walk us through how you want to be breathing through exercises properly, how you want to be bracing yourself properly? Do you mind just taking us step by step through that?
Yeah, so just even understanding what happens with our breath work and pelvic floor is really important. So we have our diaphragm at the top here. We have our pelvic floor at the bottom, and they actually work with one another. They've shown this through functional MRIs. They've shown this through ultrasound imaging as well. But when we inhale in, our diaphragm has to drop down and allow our lungs to fill up. So that's an inhale. And then our pelvic floor muscles will drop down with our diaphragm. So as we inhale in, pelvic floor and diaphragm drop down. As we exhale out, our diaphragm comes back up. Our pelvic floor will come back up. And so what we want to try and really do with lifting weights is utilize our exhale to our advantage. So when you think about like karate or any sort of fighting based motion, they're using their exhale a lot of the time to produce that force to get that punch in or to get that kick in. And same thing when we are just doing step ups or we're doing a squat. We want to use the exhale for that harder portion of that motion to create some stability at our pelvic floor, create some activation of our abdominal muscles to allow for spinal stiffness and strength through that motion. So exhale for exertion is what I typically tell a lot of my patients. And then I actually will have them use an inhale when they're trying to pee and poop to allow for some relaxation. And this is where it gets a little confusing, but when we do have to strain, we do want to use a slight exhale to allow for kind of like a coffee press pressure moment to push everything down and out. So we do eventually want to use an exhale as we are practicing opening for things like helping push a baby out when we're needing that, but also for bowel movements as well. We want to be able to use the exhale with a relaxation. So that's where it can get a little complicated, but typically inhale for relaxing and opening, exhaling for exertion to allow for a little extra stability of the pelvic floor muscles.
I like that. So when we're talking from like break it down even further, let's talk about somebody who's learning how to squat or just practicing at home squatting. So when we are on the decline, so when you're going into that squatting position, how should our breath be? Or what should we be focusing on?
That should be an inhale. So inhaling to lower and then exhaling to press your feet into the ground and rise up for that harder motion that we think about. So inhaling, lowering, exhaling through the harder portion of the motion.
So all the way through inhaling and all the way exhaling through the entire motion. So it's not like a quick inhale, holding breath, squatting down, and then for the exertional portion, you're, taking that deep breath out after you already finished the whole movement and exercise. So the exhaling and inhaling throughout the motion.
Yeah, typically. And that's for someone who is not doing heavy bracing strategies and is not excessively weak. So depends on if it's such a stand is hard, they may have to use a little bit of a breath hold, which can create some spinal stiffness to allow for it. But typically I'm going to have them try and work on the strength with an exhale motion.
Okay. Good point. And it's obviously relative to the athlete, of course, and what they're focused on as well. So for women are thinking about, maybe they're definitely thinking about pregnancy. They're going to get pregnant at some point in their lifetime. They're not sure when it's going to happen. What are some things that they can focus on now while they're healthy, mobile, and hopefully pretty able-bodied?
So just to clarify the question too, you're just for the average person who's thinking about getting pregnant, like what are the things I would recommend?
Yeah, should they be working on strength training, or what are some ways that we can help, or women that they can, what are some preventative aspects that they can focus on every day or throughout to incorporate throughout their week to help have a healthier pelvic floor? Do you recommend strength training? Do you recommend this breath work in addition? What are some things you want or you wish women could focus on for prevention?
Yeah, I think in general, every woman will benefit from strength training. I think, and I know it's very important for our bone integrity. It's very important just for allowing us to have the strength through motions. One of the things we know as we age is our bone integrity is going to be decreasing. Once we're hitting 30, our bone integrity starts to decrease. The best way to continue to build up your bone integrity is through resistance and impact training, as well as like other hormonal things, but that's super important, and research has shown that it helps with that. And so if I like to, Dr. Christina Prevett says it really well, that we are older adults in training always. We are
100%.
always, yeah, we're older adults in training. We're menopausal women in training. And I really like that thought process because we're really working, if we can change it to that, we can change it to we are preventing that deterioration as best as we can. So things like resistance training can be very helpful in keeping up building our bone integrity so we have more as we're getting older and we are moving into a menopausal state where it's harder to maintain that. And then also thinking about balance training, right? So balance training, while it's helpful for just anyone who's an older adult in training, for anybody, it's helpful in pelvic floor coordination and awareness because our pelvic floor muscles help with stabilizing our pelvis throughout our day. And so if we can work on balance, well, it will help with preventing of falls later down the line. It can also help with preventing urinary incontinence and other issues in terms of pelvic floor dysfunction later down the line.
Can you define, I counsel women on strength training a lot, and I try to do this at a young age because I see, of course, patients throughout their whole lifespan, and I really want to incorporate or talk about the importance of strength training, especially when you're younger, so you can have a decent bone density. Because we know once you hit your 30s, like you said, our bone density starts to decline or can decline. We are going to hit menopause at some point in our lifetime, and I love I never like thought of it to say it in that way, but menopause and training, or what was the saying again?
We're all older adults in training.
Older adults and I love that.
Yeah.
That's so accurate. So for my young women, I really, there's not only strength training is good for longevity, it's to help prevent metabolic syndrome. There's so many positive benefits that have been shown in research. I think people get confused about what it means to have resistance training. Can you talk a little bit about resistance training and what that means? Because obviously not everybody is going to go to the gym. So what are some resistant training? What is resistive training, and then how can that be incorporated into maybe somebody that's not going to the gym?
Yeah, that's a great question. And resistance training is dependent on the person in terms of what they're capable of doing. So really what I'm thinking about is a load on the system. And so that can, for some people, that's just like elastic bands can be a huge load on their system. For some people, it's carrying your groceries and being able to physically do that. But when we're really thinking about it in terms of strength training, we're thinking about just adding weight onto exercises. So if we're adding weight that's beyond just our body weight capacity, then what we're doing is we're going to actually see a change in bone integrity. We're going to see an improvement in muscular strength, and we're going to optimize all of those metabolic improvements that we're hoping to see. And so by actually adding weight in to our exercises or adding resistance, like bands of some sort, that's super important. But typically, I'm going to recommend most people lifting more than just 10, 15 pounds and like building up to that. I did this great female athlete course like right at the beginning of the pandemic, and we actually talked about how majority of people can lift up to their body weight. You can lift your body in and out of bed. If you're able to lift your body in and out of bed, if you're able to stand up, you are most likely able to like deadlift or squat up to your body weight for at least one repetition of some sort. And when we can start to show people their physical abilities with it and work on form with it, because to take out that fear of injury, we can start to load the system as a whole to build up muscular strength, build up bone integrity, and optimize all those things we talked about.
I love that because so many people are scared to pick up weights. And obviously, that is changing drastically, I find, and I think very quickly. But a lot of women or just people are afraid to pick up weights, or they don't think they can do that much, or they think weights cause injury. And that's definitely not always true. And form is so important, of course, as well. But I love that analogy about we do pick up our body weight. We get out of bed every day. So, we're capable of a lot more than we think we are most of the time. And that
Yeah,
goes to
yeah.
be true for not only being an athlete, but kind of in many aspects of our life, of course.
Yes, definitely. And like really thinking about all of the physical things we need to do through our day that do require us to be able to lift up weight. And I don't know about you, I hate carrying I hate carrying less than if I can get all my groceries in one go, I'm going to try and do it. And I think a majority of people will. And
100%.
that can be like 50 or 60 to 70 pounds that you're carrying on both of your arms, trying to get them up your 5 steps to get into your house. And even if we're trying to move around a couch in our house or something like that, we are going to be pushing a decent amount of weight. And so to start to realize all of the weighted things we're already doing, that's not thinking of it in like the gym weight capacity, then we can start to think when we are in the gym capacity or in the gym environment, how is adding in weights with a functional movement going to benefit us with like moving a couch into our house or out of our house, or carrying our groceries, or carrying our child carrier with a diaper bag on other arm, and how heavy that can be for a lot of people.
Totally. And people don't think about that. And even in their daily work life, if especially if you're not in more of a sedentary job, there's definitely some form of weight training and weightlifting. You're going to pick up, whether it's computer paper, whether it's, you're going to move something. There are weights in our life, and groceries is a perfect example of that. So thanks for putting that into perspective as well as for our listeners. I think that's really important to touch base on.
Mhm.
So breathing techniques, bracing, learning how to breathe through lifting, working on balance, having some weight training, incorporating resistance training into your training at some point. Those are all things that can be preventable, or helping women prepare for your becoming an older adult. So we're older
Yeah.
adults in training. Let's transition to more of a pregnancy side of things. So maybe some women that's in early pregnancy or early postpartum. Now, I guess from a pelvic floor physical standpoint, do you think, I mean, I would love it if every woman got a chance to go see a pelvic floor physical therapist. I think that would be just ideal and so helpful for many women.
Mhm.
So say there's no access, maybe they're in a part of the country that they have limited access, or for whatever reason, they can't go see a pelvic floor physical therapist. Maybe what are some things on your own that you can help work on during the recovery phase and the transition from postpartum back to becoming, an athlete again, or getting back to where you were beforehand, or changing or modifying things?
Yeah, I mean, first off, the great thing about the pandemic is it helped actually increase us as physical therapists, and I think even occupational therapists, to do telehealth appointments.
Yes.
And so we weren't able to do that prior to the pandemic. It wasn't covered through insurance and it wasn't legal. And now it is. And so that's the great thing that's come out of it. So you can find some people online. But we're also seeing this increase in some of the fitness professional apps, which is super helpful as well. And so if someone wants a guided approach, while I don't agree with all the fitness apps and like the bounce back idea, there
Mm-hmm.
are some out there that are really, really great for just slowly and gradually reconnecting with your core muscles, reconnecting with your pelvic floor. And a majority of them have a lot of explanation of like use of exhale for engagement, trying to get the inner thigh muscles to turn on a little bit better to facilitate with some overflow muscle activation. And so a lot of these postpartum fitness apps, they are out there. There are some that pelvic floor physical therapists created. I'm working with one called Mom Day Studio right now for a 6-week postpartum rehab program
Oh.
that is fairly affordable for someone trying to return back to exercise postpartum in a very gradual and stable way. And we're working a lot on reconnecting with your breath. So learning how to utilize that inhalation for expansion, being able to understand belly breathing and rib cage breathing and how that can help with relaxing and mobilizing your pelvic floor muscles. If you had a perineal tear or a C-section as well,
Mm-hmm.
learning how to expand through that tissue safely and comfortably. And then thinking about mobility, we want to have really good hip mobility. One of the things that postpartum moms are experiencing is they're sitting a lot more now because they're breastfeeding all the time.
Yeah.
And everything can become very stiff, and that in itself can create some stiffness in our pelvic floor. And so working on overall hip mobility is super helpful. Lots of hip internal and external rotation, happy baby pose, child's pose, things that are big hip openers can be super helpful in improving pelvic floor mobility, which is
Mm-hmm.
really what we want so that we can eventually progress to some pelvic floor stability. So learning how to reconnect and turn on those muscles in the pelvic floor as well as the abdomen, because everything got expanded and now everything's shrinking back down. We want to reconnect to those muscles there. So a fitness app, or even learning how to use your exhale to engage. The great thing is YouTube is flowing with information.
Yeah.
So I do recommend looking up anything from pelvic floor physical therapists on YouTube, to finding a good postpartum app that can guide you to it, to finding someone who does telehealth within your state.
Yeah, it's a good point that there's telehealth now. I agree. I think that access has grown so much, and also the internet is always there. And then finding people who, or even your account, you do a lot of teaching on it, and I think that's wonderful. So, and you do it in a way that we can all understand, which is like the beauty of it too, which is great. What
Yeah.
are some common postpartum issues that you're seeing patients for or the most common things that women are coming to you postpartum for? What are some of those chief complaints, you should say?
Yeah. So for a long time there, I was actually seeing a lot of pain with sex. So returning to sexual activity with partners, whether that's penetrative or not, and having a lot of pain, discomfort, and fear around sexual activity.
Yeah.
And that could have been because they had a perineal tear and they have scar tissue and tissue adhesions and hypersensitivity issues around the scar tissue, with nerve reconnections, or even a cesarean that has now caused a lot of pulling and of the fascia around that area that can then cause some tensioning around the pelvic floor. So I see that a lot, and I actually saw it a lot during the pandemic. It was interesting. I had a huge flow of pain with sex during the pandemic when I started doing telehealth, and I don't know if just people had a lot more time or what.
Yeah, some correlation going on there.
Yeah. And then I do see a lot of urinary incontinence with what we call plyometric, so jumping activities,
Yes.
running, heavier lifting, power-based motions, going to a trampoline park, and they want to be able to now go on the trampoline with their toddler, and they hadn't been on a trampoline since prior to pregnancy, and they realize, oh, now I feel like things are falling out of me. So I see that a lot. And then just the general, like right now I have someone who's 4.5 weeks postpartum, and we're not doing any specific pelvic floor work yet because they haven't been cleared. But we're just working on pain management, like the prolapse symptoms that can happen, that can cause like a heaviness or dragging feeling in their pelvis. And even just like perineal tear discomfort with peeing, and talking about proper peeing positions and ways of managing that so that they can pee and poop in comfort
Yeah,
after
yeah.
having a baby.
Small things that they have to look forward to. So yes, 100%. I think that's great to hear, and that's kind of interesting how it's been fluctuating a little bit. But also important to say that there's different phases as well. So they're going to be working on different aspects of your pelvic floor at different times throughout the postpartum phase, which is important as well. I do
Mm-hmm.
kind of want to transition for the last bit here I think it's so important to touch base on urinary incontinence, education based on that, maybe some preventative education that we can talk about for women. It doesn't have to be young women, can be older women. I know I see it a lot in my practice, complaining of leakage or having frequency symptoms, a lot of frequency, even in a lot of my younger patients coming in saying that, hey, you know what? I have to pee all the time. Something must be wrong with my bladder because I'm going to the bathroom every hour or hour and a half, or they think they're going all the time. Can we talk a little bit about frequency and education in bladder training?
Yeah, I think that's super important. One of the things moving back out here, I'm going to coin a term called boat girl incontinence, but it's, or just ocean issues,
Yeah.
because we are near the ocean a lot more in Hawaii, and we are in the ocean a lot more in Hawaii, and we think about the ocean and we're like, let's go pee. And so with having that access of being in an area where we can maybe freely urinate more frequently, that in itself can cause a lot of urgency and frequency around water-based activities. So thinking about just your average person and the typical urge triggers I see. A lot of the time it's the sound of running water, right? Putting their feet in water. And so those are things where that's really retraining our behaviors around water-based activities. So not just peeing every time we go into the ocean or into the shower, right? So our body starts to associate Pavlov's dogs, water with peeing. And when we are peeing anytime we are in the shower or anytime we are in the ocean, then when we put our foot in the ocean next time, our brain and our body starts to say, oh, we're going to be peeing soon. So learning how to retrain those behavioral patterns around that. A lot of the time too, it's this old potty training habits that our parents instilled in us. And that was before our pelvic floor knew what to do, before its strength built up, before our bladder understood what full versus empty was. And we have this idea where we need to pee every time we leave the house, right?
Yes.
We need to pee every time we leave the house, every time we enter a home, just in case.
Just in
And
case. The just in cases.
the just in case peas will kill people. So our bladder itself has an actual normal sensory mechanism. So we should have three different senses of our bladder. We should have that feeling of our bladder starting to fill. Then we should have that sense of our bladders getting more full, and we're probably going to need to go to the bathroom soon. And then we have our bladders super full. Oh my gosh, get me to the bathroom. When we are just in case peeing, our bladder may only be 25% full because we just peed 30 minutes ago, but we're leaving the house, so we probably should go again, right? And when that we start to do that, then the muscle around our bladder and our bladder sensory system starts to get confused of what full is and what empty is. And then it starts to become more overactive at that 25% level than at that 75% level. And we can train our body to make it think and feel like it's full when it's not. And so we want to start to decrease those just in case urinations. We want to decrease those habits that we have around urination. So like the shower stuff we talked a little bit about. We also just need to fulfill our bodies need to go to the bathroom. I too often see and it is hard with people who are in the nursing profession, in the teacher profession, even in the physician and surgeon profession, to go to the bathroom in the middle of patient care, right? That's not, or teaching children. We're not able to do that. And so people hold for much longer than they should be doing. So I typically say just making sure you're urinating every 2 to 4 hours. You're not holding past a 4-hour period. Take a break, go to the bathroom. Between patients, your next patient can wait just a little bit longer. And I know we talked about it's hard when you have you're already behind by an hour. But making sure you're not holding more than 4 hours frequently, because that can also decrease our body's awareness of what full and what not full is. And then that in itself can weaken our pelvic floor muscles when we're having excessively heavy bladders constantly on them. So those are the biggest things, is just behavioral changes. Sitting when you pee, not on your phone, not pushing out your pee. We don't want to push out our pee. We don't want to push out our poop if we can help it. And especially pushing out our pee, we should be sitting, relaxing, opening for at least 2 whole minutes, just letting everything go. We may not be urinating for this full 2 minutes, but at least sitting there and giving our body the chance to empty fully, and fully relax, so that we're not squatting and hovering over a toilet where it makes it hard for our muscles to relax and open. And then that actually can weaken our muscle around our bladder because we're putting all this pressure on it constantly. And then again, that's going to cause confusion and inability for the muscle around our bladder to really understand how to properly squeeze to empty our bladder out when we need to, but then also to relax to allow us to not feel that need to urinate all the time.
I think that's a great tip for people who do the double voiding too, right? They go, they sit down, they use the restroom, they get up, they go to wash their hands, and they're like, oh my God, I got to go to the bathroom again. I just went. I feel like there's still something there. I don't trust myself, or they leave and they're not even outside the restroom for more than a minute before they're going right back into the bathroom. So I liked your point about sitting and relaxing and just taking a minute to let things open. And you made a good point by saying you might not be urinating the entire time, and that's okay. It doesn't mean you can't sit and relax. Does that help with the double voiders, those people that get up and are basically incompletely emptying their bladder with each
Yeah, and
urination?
I think a lot of women, right, especially someone who has a toddler at home, they're like, just get this out of me, especially if they have a patient waiting for them, or they have kiddos waiting for them, or whatever. They're going to push and try and get everything out. But your bladder doesn't work like that. Your bladder has to be able to push itself, and your pelvic floor muscles have to be able to relax. When we're actively attempting to push, our pelvic floor can't relax, and it can't help empty our bladder in the way it's supposed to. For someone that does have a prolapse, my idea of a double void for like in a functional way is to sit there, urinate, and relax, and then stand up, sit back down, see if anything else comes. Or do you even doing like positional shifts? Because sometimes you can get a little pocketing in your bladder, and that helps with emptying that. But with just being able to sit, no distractions, and relax, that in itself can fix a lot of problems for people.
And I think it's really hard for women or anybody to really do to stop that just in case movements that we all have when we're leaving the house. Oh, or there's a restroom here at the store. Even though I really don't have to go to the bathroom, I just drank a coffee. Maybe I should go before we get on the road again. What are some techniques or what are some tips that you have for women that are super involved in this just in case voiding where it's almost part of their life. And so I thought that was a great point. It's almost about, it sounds like you're just having to go through a retraining process, behavioral and functional in some aspects.
Yeah, I actually just had a patient the other day that I talked about this with because I gave her what's called a voiding log where I had her track every time she urinated and at what time of day did she have an urge present? Did she have leakage around that? And it was so interesting because there were a handful of times where she would hold to her 4 hours when she was on a field trip with her kid and she was busy and they were watching whales and it was awesome. And her mind was elsewhere. And
Yeah.
just reminding her, like, your body is so capable of doing this. Like, how many other times in your life are you, like, when you're at home watching a good movie, that you're not going to the bathroom because you're really into it, or you're talking about with a friend who's going through a difficult time and you're very focused in on them. You're not thinking about urinating. And
Mm-hmm.
those, not everyone has that. There are people who actually have issues where they cannot sit through those things, but a majority of people, when I line it up for them and we're actually doing a voiding log, we're seeing you have these aspects where your brain is not thinking about peeing and you're able to hold for up to 3 to 4 hours. That's awesome. Your body is able to now do that around your nighttime schedule or your morning wake up schedule, and trusting your body's ability to, or going to the store, right? You're trusting your body's ability to hold for an extended period of time, but also trusting we have a lot of bathroom access around us. And if you're going to Target and then to Safeway later on, just because Target has a bathroom line that's short doesn't mean Safeway also won't. And so knowing that there are other accesses out there and just reminding yourself of that so you don't go into this panic like, oh, I probably should go to the bathroom right now state, because you're probably going to go somewhere that has a bathroom in 10 minutes if you really need to.
Yeah. So I guess from a perspective of the physical therapist side of things, when should we be cueing our patients to say, okay, now it's time to use the restroom. I'm having the cue. Well, do you want to wait when you have the cue? Like, what are some tips that you have for patients that are trying to like figure out when they should be going? Do they go at the first cue? Do they wait? Do they not wait? Do they push it? Do they not push it? And the sense of timing.
Yeah, and that's finding a good balance for someone's comfort level, and then where they're at in this state too. Because sometimes when I'm first starting to see someone, they have a lot of anxiety around it. I'm just trying to first cue them, especially if we know if they're going every 30 minutes and we know that that is not like their bladder's not full. We are trying to now extend those times by about 5 minutes. And if we can do that with what we call urge suppression techniques, so we do stop, don't rush, breathe, distract yourself, like count backwards from 100 by sevens or do your ABCs backwards. Sometimes that in itself can calm an urge that may be unnecessary, where you can do a bodily check-in and say, do I really need to go to the bathroom? Is this something that is my bladder is getting more full, or is this a behavioral thing that I have now trained? And then also this is the point where we might want to do 5 Kegels. We're holding a contraction, squeezing, relaxing, squeezing and holding, and then relaxing. We do that 5 times. That in itself can now say, like, let our bladder muscle calm down a bit, to help suppress that urge. And if all of those things help us suppress the urge in a way where you don't have to go anymore, you're probably fine, especially if you just went 30 minutes ago. So I do those urge suppression techniques. And then if someone still feels the need to go, they at least waited 2 more minutes than they would have beforehand and go to the bathroom. That's fine. But for someone who is like now at the 2 to 3 hour mark, they're like, okay, I maybe actually have to go to the bathroom. My big thing is just, you probably have more awareness if you're waiting up to 2 to 3 hours at this point. If you drink normal amount of water, if you are living your life and you felt that initial urge of like, my bladder's starting to fill and now you're at the it's getting more full stage, then we want to check in and just make sure, just again, don't rush to the bathroom, don't run, don't pull down your pants as fast as you possibly can and squat over and push. Same thing, you want to have slow control, get to the bathroom without that panic stage. So that's typically what I'm going to talk to someone about. So it really depends on if they're at like a 2 to 3 times an hour point, or if they're now at the 2 to 3 hour point of going to the bathroom.
From your perspective as a therapist, in general, how long are we looking at from someone coming to see you? Maybe they're on every 30 or 45 minutes. How long are you seeing it take to where they can get to that 2 hour or 3 hour mark, like time wise? Is this like a 6 month thing? Is this a year thing? Does it take 2 years? Like what kind of time frame usually are we working with?
Yeah, and I think that depends on the person. I think it depends on how long they've been dealing with it, right?
Right.
So I've been very lucky, and right now I have someone who had a very bad bacterial vaginosis that stimulated a lot of urgency and frequency. And I saw her week 3 after. Like she had never had this before, and we are now at week 3. She's being treated with flagyl and all the other BV stuff, and now she has an overactivity issue. So I don't see myself seeing her for more than 1 to 2 months, as long as we are on the right track and all the other medical things are being treated, because she's still seeing her OBGYN as well. So for someone who's not had that for very long, I typically am not going to see them for too long. 4 to 6 visits is my hope. If they had other issues that maybe are encouraging it, then it might be a little bit more. For someone who has what's called interstitial cystitis, which is actually a chronic condition that they're going to always be trying to manage, I may see them more frequently, and I may be doing more frequent check-ins. So it may be like 10 to 16 visits, and this is just for someone with a chronic condition, really working on understanding flare-up issues, urgency issues, pelvic floor issues, all of the things that may be contributing to it, and then understanding how to manage a chronic condition, and then doing check-ins about that management. So everyone's a little bit different depending on why they're having these issues and how long they've been having these issues.
Super good point. You're totally right. If this is a chronic issue, if there's an underlying health condition that's contributing, that's very different than somebody coming in for, hey, I had this infection and I'm realizing that I'm having all these urgency symptoms now post infection. So, good point. Love that you brought that up as well.
Mm-hmm.
I'd love to talk a little bit about your business now that you of course don't just do pelvic floor physical therapy. I know that you do all physical therapy. Tell us a little bit about what brought you to start this business, what got you interested in pelvic floor physical health, and I'd love to hear more about that.
Yeah. I so in physical therapy school I actually went in to do pediatrics. Like I was like, I'm gonna be
Oh,
a pediatric physical therapist and was so set on going and working in pediatrics. And then I had this I went to A.T. Still University in Arizona. It's a doctor of osteopathic medicine program. So we have a DO program connected to that. And so it's very holistic in their thought process. And we actually had a full pelvic floor class, which not all doctorate physical therapy programs have. And so my professor in my pelvic program, she was very, very passionate and excited. And I just loved her energy. So I connected her with her on that. And she convinced me to go to this pelvic floor class that was I was very into treating underserved populations, and pelvic floor therapy is a very niche, underserved amount of people. And I just really liked it. I thought it was such a great balance of orthopedic therapy and thinking about developmental milestones and how that all is contributing to pelvic floor issues. And then I took a clinical Akapulani in Oahu at their women. I did their pediatric hospital, and then I also did their women's health center. And I just really enjoyed working with women through transitional periods of their life. And it was also a way of seeing the kids as well for my pregnancy and postpartum people. So that was fun as well. And then I went to my first job in California at Community Hospital Monterey Peninsula, and I was one of 2 pelvic floor physical therapists there, and we were the only ones treating Medicaid in our area. And I just saw I saw people who have been thrown through the system, and I'm seeing them after 5 years of chronic issues, and they're finally seeing me and seeing the relief within just 3 or 4 visits, and feeling heard after being thrown through the system, and someone being like, this makes sense. this is understanding when they were just sent for test after test after test with no results was just really exciting for me as a provider to be able to supply them with like a sense of relief and someone who can actually have the time to hear them. And so that was really fun. I worked with a lot of very unique people and very unique issues, working in an agriculture based area in the Medicaid system for 3.5 years. And then my partner's from out here, so we decided to move back. And I worked at the hospital-based system, and it was really fun. And I wanted just to have that consistency at the hospital, and I like hospital work. But then also seeing my older adults with urinary incontinence and being like, I need to get back into pelvic floor therapy again. And I just wanted to start my own practice to practice how I feel is necessary for someone with chronic pelvic conditions. And a lot of the outpatient physical therapy clinics, it is really hard to create a pelvic program that benefits pelvic floor dysfunction patients in a way that I feel is important to them. So I just decided, the only way to do that is to start my own thing where I can actually have hour-long follow-ups with people, hour and 20 long evals, really make people feel heard, not get shifted off onto an aide who doesn't have a doctorate in physical therapy, and not get shifted off to someone who doesn't know what they're dealing with and doesn't know how to talk to them about it, and to have that one-on-one care with me, where I can hear them along every step of the way, where they don't have to come in as frequently as they would have for this typical outpatient physical therapy clinic.
100%. And you brought up really good points. You're creating, first of all, the space for this, but allowing the time that's needed to treat the certain condition and having the follow up. But you're also coming from a knowledge based setting where you have the knowledge to help support the patients, which you might not always find in the community. As you said, you were one of two pelvic or physical therapists in that area where you're working prior. That is insane. It's very similar in Maui. We don't have a ton of pelvic or physical therapists either. So it's really important to find somebody who really knows what they're talking about, and is really well educated, and able to help you. So how can we find you? What are some ways that we can get in contact with you? Can you share your Instagram page or anything you want to share with the audience?
Yeah, so my Instagram is Pacific Pelvic Health, all just one word, no dots, just Pacific Pelvic Health. My email is pacificpelvic.com. My website is pacificpelvic.com. And then my email is on my website. It's Anya at pacificpelvic.com. So all of those are ways that people can get a hold of me. Instagram is a great way of just getting some fun information. I don't typically want people to just follow what Instagram says with what people say you should do. As we know, we see this in any sort of healthcare setting. We don't follow Instagram. It's not individualized to you. But it can be very informative of saying, oh, I do have these issues, and that there's someone to help that I didn't know. So that can be really helpful too. So Pacific Pelvic Health, if you look it up, I should be coming up on a majority of website searches. Here on Maui, I am mobile for 3 days a week, meaning I come to people in their homes. So especially for new moms and pregnant moms, that's very helpful.
That.
Yeah. And then yeah, it's fun. It's great. I can see my patients who are before 6 weeks postpartum in the comfort of their home with a newborn baby screaming their head off. And we can work around everything, and it's great. And then I'm in clinic 2 days a week, so I can serve more people within those days, just because I'm not having calculated travel time too.
Wonderful. And I will link to all of your how to find you at the in my video link as well. And I just want to say thank you for coming on today and really breaking things down for us. I know I learned a lot as well, and I have some definitely a knowledge base, but I definitely learned a lot as well. So I definitely know my audience learned a lot as well. And I think you guys should definitely follow Anya on Instagram. She's a fun follow. It's definitely educational based and just entertaining as well. So really excited for your business journey here, and thanks so much for spending time. And we'll have to have you come back to talk about all the other things like pain, all sorts of pelvic health issues. There's so many. We just grazed the surface of it. So thanks so much for coming on, and looking forward to having you on the next time.
Thanks for having me. Yeah, we'll have to have like a whole talk about sexual health too. That's always
Yes.
fun.
That's definitely like a whole separate episode, I think, for sexual
Yeah,
health. Agree.
for
Agree.
sure. For sure. Well, this has been
Thanks,
great. Thank
Anya.
you so much.